Good morning, everybody. Thank you for joining our seminar this morning. So in this webinar, we'll speak about the health topics, but those with a digital element, let's say, even though most of the health topics in Horizon Europe funding will have digital as an important element. We'll focus on the ones that are really heavily on digital. So today with me is Jero, who is part of our team, who is the MCP for the digital topics. And he will rejoin us later on to present you the topics that are relevant for health, but that are not present in the health work program, but rather in the digital program. So we'll hear and see more of him later today, or later in, let's say, half an hour. As you probably realized, we are running a webinar series on, and the occasion being the transition from Horizon 2020 to Horizon Europe. So Horizon Europe is the new framework program of the European Commission to finance research, development, and innovation. It is the largest research program in Europe. It has several elements and various actions, various funding schemes. We try to give you a good overview over all of these actions and how they work in our webinar series. We also had a launch event even before. You can find all the recordings of these events online on our website. And you can stay up to date when you register to our newsletters, where we announce further trainings and webinars such as this one. You will notice today that I won't start from zero. I won't try to explain all the different elements of Horizon Europe program. Because we've done it in other webinars, it doesn't make sense to repeat this over and over again. So please just have a look at these elements. One thing I just want to remind you is, because in this webinar, I'll focus more on very briefly a bit what is the policy context of the European Commission in health and digital health. And secondly, I will present you some of the calls that I think are the most relevant in the health program. Now, there are other programs that are more bottom-up, meaning that you can bring your own topics, even if they are in health. I won't speak about those today. Another thing that I wanted to briefly mention before starting is that there are different ways of getting involved in these calls. So it doesn't mean if you're a newcomer to this program, to the Horizon funding program, and you don't know your way around, it doesn't mean that you have immediately to start coordinating a big consortium of 15 members for a call of 10 million or so. It's really about finding your way and trying to give an added value to a proposal, even if you have just a small contribution. Especially when we are speaking about SMEs, companies, NGOs. These are often elements that are missing in large consortia, and so of course finding these consortia, then that's another challenge. So on a more practical level, you will see on the right side you have the chat and questions. So the chat should generally be more for technical questions and remarks for our team. Whereas the questions are more regarding the content of the slides, and I will try to get to the questions towards the end then. Another question you might have, yes, this webinar will be recorded as well, and you will receive the recording afterwards so that you can have a look at all the slides. So as I said, we already given you the overview of Horizon Europe during our launch event and how to get started if you're a newcomer to the program. We have this whole webinar series on where we present in general the Luxinnovation support and services. So how we can help you as an NCP, what Luxinnovation is as an innovation agency, Just as a brief reminder, we are there. We are the national contact point for Horizon Europe, and we are there to help you. And you being any legal entity based in Luxembourg, public or private, to participate in these programs. So we try to help you find the best opportunities. We offer trainings, but we also do proposal reviews, which can be very useful. Other related calls will have partially already been presented, for example, on AI and digital. So you can look at the recordings. I put the link down there, but you can find it also, I think, very easily. Sorry, another highly relevant webinar will be on March 11th, which will be the health topics, where I will focus more on anything within the health program that is not so straightforwardly digital, let's say, if there is such a thing. So again, very brief reminder what we will speak about today. This is the general overview of Horizon Europe. We'll speak mostly about health, which is one of the global challenges in Pillar 2. So also called the health cluster now, and then the digital topics, which is another very large cluster within that program. So just to give you a brief context of the policy, and what I mean here is that I want you to realize that all these topics, all the actions of the European Commission, they are not happening in isolation. They are part of a larger policy background, and it can be not always very visible for you if that's not something that you are used to reading or to following. But it is important once you get started in writing proposals. And so many of this information can be found within the work programs, and they can also be easily found if you just Google, I don't know, digital health and Europe. I'm sure you will find very relevant links very easily, but it should be considered a bit of a reminder. So one important element is the digital single market. Jérôme later on will speak a bit more about this in detail, but I will focus a bit on the e-health part of this policy initiative, which was launched a couple of years ago, and that's really about the transformation of health and care in the digital world. And there are three main pillars in this, and you will see they are reflected in the calls as well. So one is access, well, first of all, health data itself, but then also access to the health data, especially by citizens and everything that's linked to that, security, etc. But involving citizens, putting citizens and patients in the center, that's really an important element of Horizon Europe. Then you have personalized medicine, which has always been, or not always, but for a long time, been a strong focus. There are different words for describing the same concept, but I think you're very familiar with what personalized medicine stands for. But you can also see that Europe data infrastructure, so meaning, again, there are already existing initiatives around Europe that it's very useful if you get started in Horizon Europe to build upon these initiatives and past projects, findings or infrastructures, to involve them and to make good use of them. The third pillar is citizen empowerment. So that's, as I said already before, the citizen is very much at the center of the Horizon program. And it is so with digital tools to empower really the citizens to be able to give feedback. We see this in the health context a lot with the prompts and the prems. So this is just one element. There's real world data, there's sensors, there's mHealth. So there are many aspects around this that all feed to this. But for the Commission, an important element is really the citizen and how these solutions reach the citizen. And that's also why it's so important in these, once you get started to answering to these calls, that you try to cover this whole value chain. It's not only maybe like it was in the early days where it's just academic research applying for these projects. No, it's really about finding solutions, tools, services that should reach citizens, should reach the end user. And for this, it's important to really involve a lot of actors, ranging from industry, of course, SMEs, NGOs, patients associations, etc. Really everybody along the value chain. So these are the main what are called the destinations now in the health cluster itself. So these are the main themes, and all the calls will be distributed among these six themes. I'm not going to read them aloud, but you can have a look yourself. Many, of course, reflect anyways big sections of fields that have been known for the last years in Horizon 2020. So there's really a continuity of this. For example, in the aging society, demographic change, but then chronic disease, infectious disease, etc. And you can also see in this slide, I try to illustrate that digital is really something that flows across all these different topics, as you, of course, are well aware of. Finally, for the introduction at least, there's also health beyond the health cluster, so beyond the health calls. I already mentioned, of course, other related work programs. I also mentioned more bottom-up programs like Marie Curie, ERC, EIC, which are all very relevant, but you can come with your own topics, so it's open. But more relevant now for health is on one side also the cancer mission, which is not totally defined yet, but it will enter a first stage of bringing together the main stakeholders. You might remember, or maybe you don't, but the mission approach that the Commission has announced a number of missions as part of Horizon Europe. And the name mission comes just from this reference to the Apollo missions to put a man on the moon. And that's a bit the same thing here. There are different fields, and cancer is one of them, probably the one that's the most relevant for health, obviously. And it is well aligned with the Beating Cancer plan. So that's more the policy angle, while the cancer mission is more the RDI angle of this push by the European Commission to advance research on cancer. And so there will be concrete funding opportunities along these streams in the coming years. Then there are partnerships. So they are also part of Horizon Europe. They are more related to what you might remember as Aeronets in the past. There are different forms of partnerships that require various, let's say, commitment from member states in order for you to be able to participate. If you have any questions, you can always get in touch afterwards for any of these topics, by the way. I put here the three most important ones. The first one being the Innovative Health Initiative, which is the follow-up program of the Innovative Medicines Initiative, the IMI program, which many of you will be familiar with. In IMI, there was basically the European pharmaceutical industry working together with the Commission and the member states to fund important research projects. In EHE, this will be somewhat expanded. There is not only FPR, which is the pharmaceutical industry, but there's also COSIR, who is the, more representing the, let's say, data digital imaging angle. So there will be different types of research, and as has already been the case before, data and digital will remain a very strong element of this. There's also the THCS, the Transformation of Healthcare Systems Partnership. This is one example of a partnership where we don't know yet if Luxembourg will be part of it. This is outside of our control as Luxinnovation. It's partially a follow-up program of the AAL program that you might have been familiar with, even though the main focus is slightly different, and it's really about changing and comparing health systems between member states, sharing good practices, running pilots of very often digital solutions that are being tried out in one member state and work quite well. So in order to translate it to different healthcare systems. There's also the Pandemic Preparedness Partnership. Sorry, that's a more recent addition. And this partnership, as the name suggests, will be heavily oriented towards, obviously, the COVID crisis and research. But the pandemic preparedness angle here really reflects more on the also on health and health research, rather than the various aspects, of course, of preparedness, for among which, of course, the economic aspects and social sciences, but they are not the main interest here. There are various other partnerships, but I won't go into detail on them, and you can find them online also, because they are not as strongly digital as these three. So first, before showing you real topics, I'm giving you a few keywords, and you will recognize these obviously if you're in digital or digital health, e-health. But these are keywords that are present throughout the work program, throughout all the topics that will be released. Health data obviously is one of the stronger ones, and all the aspects that are linked to it. It can be with regard to health records and patients registries, but it can also be on any other sort of health-related data. We see all these multi-omics projects that need to make sense of all these big data. But it can, and then there's all the aspects around it, GDPR conformity, fair principles, anonymization, sharing of the data, access of the data, etc. There's some mentions of this, the European Health Data Space. This is another policy initiative of the European Commission. Unfortunately, I'm not very familiar with all the details yet, but I think that will be an important element that we should keep on our radar. Artificial intelligence and machine learning is present throughout all of our work in all the different research fields. So it's also present here, obviously, in various different flavors. Smart devices, medical devices, connected devices, etc. Are an important issue. Health economics to some degree, health technology assessments, but then also modeling of various scenarios. I think that's largely the main keywords that I wanted to mention. Okay. So I think we'll get started now in some of the topics of the health cluster. So that's the cluster one. You will see that I'm mostly giving you the titles here. Of course, there's no real possibility to go into depth of all the different topics. But please get in touch with us afterwards if you have interest, if you want to have access to the draft topic texts. They will be released made public in a short time. There might be still some minor changes, but I think that for the most part we have a pretty good idea. So what I'm trying to give you here, as I said before, so it's an identifier. That's just to identify the topic, the title, what form of topic it is. So in general, you have RIA projects. These are research, innovation, and research and innovation actions. So that's generally more the research-heavy, early to mid-stage of technology readiness level projects. You have the IAs. These are the innovation actions. They're a bit further along the line. And you have the coordination support actions, the CSAs. Now, the CSAs, they're not there to fund research directly. They are to help you network and build structure certain topics, or not topics, but certain domains that need structuring, coordination throughout Europe. And very often this results in draft texts, or in policy papers, in recommendations, in guidelines, in tools, in platforms, which will then in a later stage be very useful for various other purposes. So sometimes these CSAs are a bit neglected by our participants. I have the feeling. But I think it can be a very valuable source to be involved very early on, to help you network and give you an overview of what's there to come. So then I try to highlight also a bit what's the main messages, main elements of these calls. And so that you get a pretty good idea. So I won't get into all of the details for all of the slides, but let's go through this briefly so that we are all on the same page. So if we have the first example, that's a CSA, so it's on health literacy. That's really bringing together all the actors that work on health literacy and how the digital elements can help with that. To bring these people together. That can be companies, that can be researchers, that can be administrations, that can be associations, to structure and give guidelines for the future development of these tools. And that will then certainly later on result in further calls for funding. And so you're in a very good position if you have been participating from the start, basically. You see on the left, there's I labeled a bit when the deadlines are. The deadlines are also present. Some calls will only have a deadline in early 2022, while others have the deadline this year, so in September. You see this. The second topic that I present is AI tools to predict the risk for chronic diseases and their progression. So this is very much in line with topics that we had previously. And so that can be a very good starting point for you as well. If you know which topics have been present in the past, these are things they are publicly available. You can find them. And you will know which kind of participants were in these projects. And you can be sure that at least a part of them are very interested in participating again in the same type of projects, of course. So it's always good to align with people like this, especially if you know them already, if you have connections to them. And if you really don't know your way around, feel free to contact us and we can help you find the right partners. On this slide, you have, again, an AI topic for treatment and care. So that's more about clinical decision-making. You have a topic on rare diseases and new therapies. So while that is not directly a digital topic. There are certainly elements in medical device development, including software, of course, that can help in developing these therapies. On this slide, you have again decision support tools. So that's a recurring topic that we've seen also already in the past. They can be very important for helping clinical decision makers, but also for policy making. For example, through visualization tools, digital twins, etc. So these are all keywords that are of high interest for Luxembourg as well. Then we have a topic on smart medical devices and their implantation. So smart here refers to connected devices. There's the more clear definition in the topic text. And you can see here that that's an example for an innovation action, so a bit further along the line. I forgot to mention, but maybe let's repeat it again. So all of these topics, they are for consortia to apply. These are not for single researchers to apply. These are consortia, hence also the large projects. Then we get to innovative tools for using health data and reusing health data. So there's a strong tie with electronic health records and patient registries. And it's still, you can see, even though there's a lot of progress been made, you can see that we are still facing the same issues that need to be addressed, be it interoperability, verification of data, accessibility of data. These are things that have been present in the past and that are coming back because the solutions that we have are not at the level where we need them to be. Then the second topic here is on real-world data. So these are data that are collected outside of the clinical setting, outside of clinical studies, very often with devices, wearables, mHealth applications, etc., or synthetic data generation, and also here there's a link to decision making, so more policy, but also health technology assessment, which is something that we are not so strongly involved yet in Luxembourg. So then I'm coming towards the end of the digital health topics in the cluster 1. So here you have one on computational model for patient stratification. I think the title is already very self-explanatory. You had in the past projects on the virtual physiological human. So this is really, it's not another word for digital twins, basically, to help model patient behavior and disease progression to predict risk. Another one is on mHealth labels. As you probably realize, if you're from that field, there's millions of probably mHealth related applications and very little certification. And so this is a bit on designing a European label for mHealth. So if you're another CSA, so not a research action, but bringing people together. So if you're involved in this, even if you're companies, that can be very interesting for you to get in touch with really the relevant actors. So final slide from my side. So that's on the cybersecurity. So of course, all these medical and connected devices need to be secure as well. And then HPC and high performance, but also multi-party computation are very important. You can see the topic of the keyword of synthetic data. That's something that I see coming up more and more. And then that's it from my side. I will get to you again towards the end for possible questions, and I hand over to Jérôme. Thank you.
Good morning, everyone. Can you just first confirm me that you can hear me? Charles, can you just make sign? Yeah? Okay, it works perfectly. Good morning, everyone. My name is Jero. I was quickly here at the beginning for saying hi. I'm the one in charge of the digital aspect and the digital topics inside the war programs. And I'm going to quickly make an intervention here. Also, it's intervention is not the good word, because some of the topics that I'm covering are not necessarily focused on health. They are not necessarily hardcore health topic, but health applications is possible. I'm sure you can understand that digital being a transversal, we are addressing topics and research innovation activities, which one of the application can be health. Doesn't have to be the only one, can be the multiple applications, but that might be something interesting for you. So I'm going to use more or less the same approach than Charles. Actually, I'm going to use the same approach than Charles because it's his webinar. So I'm going first to address the policy context, then a buzzword, and then quickly show you the topics. So when it comes for the policy context in digital, what you have to remember from the policy perspective is that the main policy is called Shaping the European Digital Future. It has the three pillars that you see written at the moment, written as bullet points on your slide. However, what you have to remember is that they are high. It's the high-level policy. So you can go and read it. You can see that it's full of inspiring words and inspiring wheels and objectives, etc., etc. But after, when you come for hardcore regulations, it goes down to several different documents. And those several different documents is the one that I've been listing here. What I would like to bring your attention on is, since it's really based on digital, they are affecting the digital core activity, including the one related to health. So there are extra regulations, extra policies at EU level that are targeted to be implemented via the Horizon Europe calls, and they will affect your daily task as health practitioners. So you have the Digital Service Act, which is currently being processing between the different legislators. Basically, to make it very simple, it's new rules for data platforms. You've got the Digital Market Act, which might not be exactly for you. It's more. This one is more targeting the big GAFAM, the big digital platforms. You've got the Cybersecurity Act. Charles mentioned it very quickly, and I can only bring your attention to also another cluster of the work program, which is cluster 3 on security. And the two main one, or at least the three main one that I'd like to really bring your attention is the first one is the European Data Strategy, and actually I should have written it differently. It's called the Data Governance Act. So this is really what are the rules for accessing and sharing the data, and what environment, what ecosystem should be put in place so that you share the data that you have, including private data, in a trust way. So in a trustful manner and in a trustful environment. This one is raising a lot of questions regarding the share of data, specifically related to personal and health data. Finally, you're going to hear a lot with me about AI, which is not surprising. Charles has already presented to you some AI topic inside the cluster 1. There are many topics in the cluster 4 as well. And what you should remember is that all those AI topics are actually under the same umbrella from a legislative point of view, which is the AI coordinated plan. And the key buzzword that you need to remember here will be trustworthy AI. So Europe, we're not the strongest in AI. We have two bigger competitors that are ahead of us, US and China. But the target is not to be the first. The target is to do an AI that is embedded with our values, with European values. And this is to stay in a race. We don't aim to finish first, but we aim to stay in a race and to have our own AI. Because we hope, or at least it's what's in the mind of our dear legislator, we hope that it will do the same like for GDPR, which is the last policy. It's so much appreciated at international level by the citizen that countries start to adopt the same rules than the European Union did. So the last thing is about data privacy, GDPR. This one is already up and running. You probably remember all the emails we had where we were giving our consent for participating to those mailing lists. There is a specific provisions regarding health data in GDPR, and we are already talking about updating GDPR data, specifically related to IoT data. So remember that if you are interested in any of this, the last four are the most important one for you. Okay, in terms of keyword or buzzword, basically for the cluster 4, you have here the list, which is kind of similar to the one of Charles, you will see. Database innovation. So in cluster 4, we don't look at the data application for health. We say data is transversal, but health can be an applications. And that's linked with my third bullet point. You talk in terms of health application. Health is one of the applications possible. We have topics which are set for GDPR enforcement. So again, for ensuring data privacy, which is quite important for health. Autonomous AI are the last keywords that are the most important in cluster 4. I move forward to the list of topics now. So if you have attended to my webinar before, actually you will see that there is some sort of synergies between our webinars with Charles. And most of the topics we already have spent a webinar addressing them. You will see there are very digital topics, but there are topics where an health application can be used. The first one I want to address are those tools, which are about data sharing and creation of data spaces. There is a specific provision for creation of a data space for health at EU level, and more specifically for genomics. I'll come to that in a minute, so please keep that in the back of your head. Those topics here is to develop the solutions, and solutions, take it very broadly, for helping the management of the data space or the management of the data itself. On my side, just for your information, you will see on the right side of your screen, you will always see the indications related to the topics. So the deadlines, the budget for the topic, the instrument, and the expected size of the project for the topic. This is to give you an indication about what the Commission is expecting. I move forward for my second slides, which is about, this time is about data analytics. So the Commission, as you heard, we have invested with the member states in high performance computing and data analytics schemes and methodologies and infrastructures. Now we want to go even higher. So we want to go to the extreme data mining. And when they say extreme, they don't say specifically in terms of volume, but they say in all the diversifications that can exist when you have data, structured, unstructured, format, unformatted, small volume, big volume. So this tool is really to address this topic, sorry, is really to address the tools for data mining. If you have a lot of health data, if you're interested in a lot of health, or if you have a developing solution using the data spaces, this is the next stage. This is ready to push to the next level, and they need industrial test bed in this topic. So here you can be the one bringing the industrial test bed to those projects. I go to the next one, which is this time we get away from the data and we look more on the hardware side. And when I say the hardware, I'm talking robots here, not machinery or computers, but mainly robots. There is an entire section aiming at developing new generations of robots. And here we're talking about transversal modules for robots, meaning that health can also be in applications. And in the past projects, health has often been an applications where robots were used in hospital environment or in laboratory environment. So here it might be a topic of your interest for this. I go to my next slide, and it's going to be the last information. So this one is about AI, leadership in the AI. So again, the focus on the digital on the digital component, but with application of health. And I wanted to address actually two topics that are maybe a little bit on the edge here, but I just wanted to share them with them. The first one is about tackling gender, race, and other bias in AI. With the data set that some of you might have, this kind of topics can be interesting for you because I can just help to make better AI, specifically for health, addressing or being able to address the specificities of a human biology. And here that might be relevant for you. Please go see the webinar we did on 11th February for that. Another one is about AI to fight disinformation. You might think this might not be really relevant for you, but actually I just wanted to mention it because it's really turning around the misinformation against fake news that has arisen around COVID-19. So it's not the only aspect that should be addressed, but any medical disinformation that you can find online, this topic wants to address it. I think this was my last slide. Oh, no, yes, I forgot to say. I want also to bring your attentions to other programs beyond Horizon Europe that's going to be really relevant for you. The main one that I would like you to keep keep in the back of your head is the Digital Europe programs. Inside the Digital European programs, the Commission will invest 1.9 billion euro in the next, I'm going to say 7 years, but I think it's the next 2 years, for creating AI ecosystem, and more specifically data spaces. And there are 6 sectors that has been decided to create it EU-wide data spaces, one being for health. So I can only invite you that if you, I think I'm talking more to the LCSB here, or to the people turning around the LCSB in the audience. If you are interested in participating to the creation of a EU-wide data spaces for health, and more specifically genomics, I can only invite you to have a look at the Digital European program and come back to me. The two other programs that I want to mention, the first one is obviously EuroHPC, where they are looking for applications. So EuroHPC is a program for the investment and the capacity development in high performance computing. So big machine making big calculation very fast. And here they do a lot of, they were looking for application in where health can be the focus for data mining. It can be also for modeling. I didn't write it on the slide, but modeling, but also finding new cure. And actually, there is a specific course for COVID-19 modelizations or use of AI for finding solutions for COVID-19. Finally, last programs I want to mention, it's called the Key Digital Technologies. For those of you who are familiar, it was Excel before. Also, it has evolved a little bit. Here, we're talking about the embedded system value chain, which data is part of it. So it's a new type of sensor, new electronic device, and health is one of the focus area for this digital program. Okay, that's all from me. I stop here, and Charles, I send back to you the floor.
Thank you, Jero. Thanks for giving us this aspect as well. I think it's very important to highlight the links between the two programs. I see just one question so far, and that is on if the accessibility of information is part of the Horizon Europe program. And it is very much so. I mean, especially in the health program, if you're not familiar with the FAIR principles, accessibility is one of them. And the FAIR principles, they are highlighted in, I would say, 80% or so of all the topics you find in cluster 1. So it's certainly something that's very high up on the radar. If there are no further questions, I would like to thank you again very much for taking your time and listening to us. Don't hesitate to get back to any of us at any time where you need help with finding further topics, finding partners, etc. That's really what we are here for. Yes, one question on sharing the presentations. The recording will be sent to you automatically afterwards, but you can also find it afterwards on the website, so you can have a look. Which programs are available for individual companies and not consortia? So this is certainly not what we were speaking about today. I would recommend you to look at the webinar I did with my colleague Stefano on funding opportunities for, I think we called them newcomers. So the recording is available. There we focus a lot on the Marie Curie program, and we focus a lot on EIC. And I think both of them can be very interesting, especially the EIC for companies. Where can the detailed information be found of the projects we presented? I presume you are speaking about the topic texts of these calls. You can get in touch with us and we can discuss it, what information you need. All the information we showed you today are not publicly available yet. They will be announced soon and made public soon. And in that, as soon as that is the case, you can find it, of course, on the funding and tenders portal of the European Commission. It's somewhat easy to find. It's a bit more difficult to navigate. But again, if you need require specific information, please get in touch. Let's check the chat box quickly if there's nothing else. I don't see anything. So again, thank you, and hope to hear from you in the coming weeks.